start.
Can you see my screen?
Yes.
Okay, so I can start, yes?
Yes.
Start.
Good morning, everyone. My name is Oksana ARTEMCHUK. I am a medical epidemiologist from Ukraine, and I'm going to present you knowledge, attitudes, and practices survey towards pneumococcal disease and vaccination among primary healthcare doctors conducted in Ukraine in 2021. Pneumococcal disease caused by bacterium Streptococcus pneumonia is a major public health problem, causing, among other respiratory infections, meningitis, bacteremia, sepsis, mainly in young children and the elderly, while an effective treatment and vaccine exist. Annual incidence among children less than 2 years in Europe, 44 per 100,000 population. And in USA, 167 per 100,000 population. In Ukraine, a country with 42 million population, in 2019, only 50 cases of meningitis were registered. And 22 of these cases were in children up to 17 years. And this suggests high underreporting. In Ukraine, vaccination against pneumococcal infections is recommended for children under 17 years and adults, and specifically for children from closed groups, and for elderly, especially those elderly living in long-term care facilities. However, the PCV is not free nor is reimbursed, and PCV coverage in Ukraine is very low. As of 1st May 2021, 1,135 people were vaccinated with PCV. In 2022, Ministry of Health of Ukraine will introduce PCV into national calendar for children up to 5 years as mandatory and free of charge. It is known from the literature that doctors' good knowledge and positive attitudes lead to better practice and increased coverage. In Ukraine, the knowledge, attitudes, and practice of primary care doctors towards pneumococcal disease and vaccination are unknown and unexplored, since no studies have been conducted. The aim of this study is to assess the knowledge of Ukrainian primary care doctors about pneumococcal diseases and vaccination, their attitudes and practices regarding PCV vaccination, and to identify possible barriers for the PCV implementation in order to guide programmatic decision and future implementation of PCV in Ukraine. In March 2021, we conducted nationwide cross-sectional study. Our study population were all primary healthcare doctors with permission to conduct vaccinations. We included in our study internists, pediatricians, general practitioners working in state or private primary care institutions or private practices, and have a contract with the National Health Service of Ukraine for conducting preventive vaccinations. We excluded from the study doctors without names in the sampling frame list, and we used simple random sampling based on official list of doctors with permission to conduct preventive vaccinations. This list is available at the National Health Service of Ukraine official webpage, and it is regularly updated. Data were collected using a structured, anonymous, self-administered online questionnaire developed in Google Forms platforms. We collected socio-demographic and primary healthcare facility characteristics, knowledge about pneumococcal disease and pneumococcal vaccination using multiple choice checkboxes type of questions. Attitudes and practices toward PCV using 5-point Likert type questions. Perceived barriers in PCV implementation using multiple choice grid, and we asked study participants to evaluate barriers as no problem, small, medium, big. The questionnaire was piloted prior study to ensure comprehension and usability of the questions and time to complete the survey. We created a scores for 5 outcomes. First outcome, PD knowledge, included 6 questions in total regarding disease cause, transmission, manifestations, severity, affected patients group, and treatment. And we created a score for PD knowledge by summing scores of these 6 questions, and a range was from 0 to 6. Second outcome, PCV knowledge included 5 questions in total regarding existence of PCV, types of vaccine, dosing, patients group, side effects. We created a score for PCV knowledge by summing scores of these 5 questions, and range was from 0 to 5. Third outcome, overall knowledge, included 6 questions about PD knowledge and 5 questions about PCV knowledge. We created a score for overall knowledge by summing scores of PD knowledge questions and 6 PCV knowledge questions, and a range was from 0 to 11. Fourth outcome, PCV attitudes, included 3 questions in total regarding PCV importance, safety, and effectiveness. And fifth outcome included 2 questions in total regarding recommendation of PCV to children and to elderly. We used Likert methods of summated ratings for calculation scores for attitudes and practices with a range from 1 to 5. And we define PD knowledge as low, moderate, and as high. And we defined PCV knowledge and overall knowledge as low and as moderate, high. Also, we defined PCV attitudes and practices as negative, neutral, and positive. We performed descriptive statistic, and we calculated prevalence ratio and 95 confidence intervals using Poisson regression model. Response rate was 46%, and the majority of study participants were females, middle-aged, family doctors from west north parts of Ukraine working in state healthcare facilities. As you can see from this table, majority of study participants had low moderate PD knowledge, moderate high PCV knowledge, and overall knowledge, positive PCV attitudes and practices. Doctors perceived parental-related barriers as biggest barriers toward PCV implementation, and other barriers such as doctors, nurses-related, vaccine access and logistic-related were evaluated as small, not a problem. Awareness of child-related Ukrainian Ministerial Order was associated with high PD knowledge. Doctors aged 47 years and more were less knowledgeable about pneumococcal disease. Positive attitudes toward PCV effectiveness was associated with moderate high PCV knowledge. Female sex, positive attitudes toward PCV, identification of vaccine unavailability as medium big barrier were associated with positive practices. It is interestingly that no factors associated with moderate high overall knowledge and positive attitudes were found. We acknowledge limitations in our study. We were not able to conduct stratification by region, health facility, doctor specialization, and we had some technical challenges with jumping section of questionnaire. And we acknowledge that study participants could provide socially desirable responses for fear of potential problems at work. To avoid this, we included comprehension information in the invitation letter explaining protection of anonymity and confidentiality of study participants. Errors could also occur during the online completion of the questionnaire, and this could influence the data quality. To reduce this, an appropriate explanation was provided on how to respond to each question. Study participants may have used external sources for completing questionnaire or asking another doctor to nurses to complete it. To reduce this bias, study participants were politely asked not to use the external sources of information and complete the questionnaire personally. Majority study participants were female, mid-aged, from Northwest and state healthcare facilities. Moderate pneumococcal knowledge, positive PCV attitudes, and neutral practices were observed. Parental-related barriers were evaluated as the biggest, and doctors, nurses-related, vaccine access, and logistic-related barriers as smallest. Older doctors were less knowledgeable about PD, and doctors aware of child-related Ukrainian Ministerial Order were more knowledgeable about pneumococcal disease. Doctors with positive attitudes to PCV effectiveness were more knowledgeable about PCV. Factors associated with positive practice were female sex, positive attitudes towards PCV, identification of vaccine unavailability as medium-big barrier. We recommend to Ministry of Health of Ukraine, prior to PCV implementation, develop proper planning, logistic, and supply. Conduct educational activities with offline, online, or cascade mode of delivery, targeting all primary healthcare doctors to increase PD-PCV knowledge and PCV recommendation practice, and especially older doctors to refresh pneumococcal disease knowledge. And targeting parents to increase PCV awareness and address parental barriers. Based on our study findings, we recommend to include in content of educational program evidence-based scientific data on PCV effectiveness, safety, and importance to increase positive attitudes and practice, and to include Ukrainian Ministerial Order to promote knowledge and execution of this order, and planned PCV logistic and supply to address undisrupted vaccine supply concerns. Also, we recommend to conduct survey among parents to identify their gap and barriers. We can conclude that moderate pneumococcal knowledge, especially in older doctors, positive PCV attitudes, especially among females, and neutral practices were reported by study participants. Doctors perceived parental-related barriers as medium-big, and we recommend to confirm this finding and to conduct survey among parents to identify their gap and barriers. Concern of vaccine unavailability was one of the factors associated with positive practice, and to address this specific concern, we recommend proper implementation planning. We recommend educational activities for doctors in order to increase, refresh PD and PCV knowledge and awareness and parents and address parental barriers. I would like to express my gratitude to Dr. Iro Yevlampidou, Dr. Man Rodina for their help and support. Also, I would like to thank Public Health of Ukraine Center staff, Victoria and Marina, for their assistance in conducting this study, and to directors of regional healthcare departments, and to all doctors who participated in this study. And thank you to all of you for your attention.
Thank you, Oksana, for your excellent presentation. Milena,
Thank you.
can you, yes, so how
okay.
long the presentation was?
Okay.
I think it was more than 10 minutes, yes?
Yes, but first of all, to say great presentation, congratulations. It was really clear. Okay, regarding to duration, a little bit, it is a little bit overdue. It is 14 minutes. It's okay. We can discuss about that. So 14 minutes. And shall I start or shall I start
Yes,
with?
yes, or maybe I can start, you can continue. So for me, the main message what I got is what people, healthcare workers, primary healthcare workers, we have moderate knowledge about the pneumococcal disease, and so vaccine hesitancy was so not so uh, mm, common problem for healthcare workers. They knew about the disease and about the vaccine, and maybe you can continue.
Yeah, maybe to start with availability of vaccine to be free and available
Yes.
to everyone. Then to point the main issues that Oksana already pointed. All the doctors had moderate knowledge, so that is the weak point, and that we need to work on education on parents. In order to reduce that hesitance, so maybe we can,
Yes.
we can work with education in order to in order to change this epidemiological maybe situation. But also she mentioned that there is a lack of studies.
Yes.
If I'm sure she started with the data from European Union and USA, so we have underreporting. So maybe we in the community, they don't still recognize, due to that lack of studies, they don't recognize that as a big problem. Maybe because of the lack of the study, they are not aware of that, how important is vaccination against pneumococcal disease.
It's okay. So other parties
express their ideas as well about the presentation. Mariam, what do you think?
Hello, everyone.
Yes. Hello.
Yeah, now I can hear you. Sorry, I had connection problems. Oksana, thank you for such an excellent presentation. It was really super interesting, and I was like following. I wasn't able to go somewhere else, so I was really concentrated. So it was super. Thank you. And everything was following sequentially, I mean. So as I got, the main idea is that in Ukraine, the pneumococcal disease has the burden in children. So it was essential to conduct a CAP study among the primary health practitioners. And as a problem relief, there was some barriers. So you should address this with the awareness campaigns and also the proper planning and educational activity should be done. So thank you so much again, and good luck, of course. It was really nice.
Thank you.
Right. What is the structure of? Do we need to go like slide by slide the discussion, or this is what we have to do, right?
We will start with general comments. Yes.
Okay.
If someone, yes, if someone has something to add, please.
Yes.
Please, Samer.
Okay. Thank you, Oksana, for your presentation. It's very nice, informative, and you have many things to deal with, and it's a very large study. Regarding your it's your presentation is very informative and on point. You present that pneumococcal pneumonia is a public health problem in Ukraine, and your CAP study reflect that there is a need for increasing the or improving the awareness among doctors and other health workers. Thank you.
Thank you very
Congratulations.
much.
Yes, please. Good morning.
Yes, Rehan, please.
Yeah, first of all, I would like to thank Oksana for the nice topic. As a veterinarian, it is totally new for me to know even about this disease. And I agree with Samer for the Soko that you have a health problem in Ukraine, and more awareness maybe and vaccination should be accomplished in the country for doctors and maybe other persons like small children or so on. Thank you.
Thank you, Rehan.
Thank you. Anyone else want to add something? Okay, so I think the so-called was clear for us. If you want Oksana to share it, please.
Yes, thank you very much for all of you for your kind words. Very much appreciated from my side. So take-home message from this study, it is that prior implementation of pneumococcal vaccination in Ukraine, there is a strong need to conduct educational activities targeting primary healthcare doctors to increase pneumococcal disease, pneumococcal vaccination knowledge, and pneumococcal vaccination recommendation practice. And also there is a need to conduct survey among parents to identify their gap and barriers.
Okay, thank you. Then can we start with the slides, with the presentation of the slides?
Can you see my screen?
Yes. Yes, I can see. Someone has.
Yeah, I'm gonna start, Annie.
Yes. Yes.
Thank you. So for me, the title is really nice. It has the place, time, itself, what kind of study was conducted, about what it was conducted. So for me, title is super, and I don't have any other comments.
Well, it's really good. I mean, as Mariam said, so it's really clearly described. So I also agree with.
So we can go to the next one, I think.
Yeah. Yes, please.
So what is interesting, it is the situation in most country in Europe and around the world that most country has lack of data on this issue. We are using data of England. We in our country we are trying to impose this vaccination as a part of immunization schedule for children, also as you. So we don't have our data. So I saw this that you are recalling on European Union data and data of USA. So we are underreporting and probably underestimating the size of this problem. And it affects, of course, awareness of the problem or burden of pneumococcal disease. But pediatricians, they are very loud when they are speaking about pneumococcal disease. They are talking about reducing of antibiotics for middle ear infections. So this is another one approach. Maybe we can mention that. I'm not sure if there are data that countries that have pneumococcal disease reduce very high. They had a very high reduction of antibiotic use for middle ear infection. So I think this is a great background. It's got enough information if anybody wants to say it.
I'm gonna add to Milena's sentence. So it's really nice slide, but for me, as a suggestion, I would have divided that in two parts, maybe as a background information in the whole world and just background that it's what is its clinical manifestation and annual incidence in Europe or the USA, and that vaccination exists. And then on the second slide, maybe I would have talked about the Ukraine itself, because in some moment maybe it's too much for one slide, I mean the sentences, but otherwise it's giving the whole information, and if you're not familiar with this disease, you're able to familiarize yourself and then understand what it's about. So thank you. It was just a suggestion from my side.
Thank you, Miriam.
May I just ask one question? You wrote here that as of 1st May 221, 1,135 vaccinated people. Those are only elderly people, yeah, for splenectomia or something like that? Or is it the children?
This amount of people vaccinated with PCV included all adults, children, elderly, so all age groups included in
all age groups.
Yes, because this vaccination is not free, is not mandatory, it is only recommendation to get vaccinated with this vaccine. So information included all people who get vaccinated. So it's not about only children or elderly or any specific.
Yes.
Sorry. Please go ahead.
Yes. Regarding the slides, it has all the information. It's very nice, but it looks somewhat busy. I think in the third bullet, you have the incidence rate in Europe and USA. And in the fourth bullet, you have the number of pneumococcal meningitis in Ukraine. It's a bit, I think maybe you can make one bullet from this two bullet and calculate the incidence rate in Ukraine to be comparable with the USA and Europe incidence rate. And in this way, you have one bullet. Thank you.
Thank you very much, Samir. Ani, may I address this comment, please?
Yes.
Thank you very much for this suggestion, but I'm afraid it is impossible to calculate incidence rate, and I'm going to explain why. So in Ukraine, we have monthly and annual statistic regarding infectious disease cases and incidents as well. But these numbers, 50 pneumococcal meningitis cases in adults and in total and 22 in children, I do not know which denominator I can use in order to calculate incidence. Because as I said in my delivery of presentation, we are a country with 42 million of people, but this is official data reported by National Statistics Service and by Eurostat. But the truth that unfortunately, because of annexion of Republic of Crimea and annexion of eastern part of Ukraine due to Russian aggression, the total population of Ukraine, not 42 million, but probably 38 or 37 millions. But I cannot know this for sure. So I do not know which denominator I can use in order to calculate incidence. That's why I decided just to leave these numbers, absolute numbers, from the annual statistic report.
Yes, as we mentioned, it is really underreporting.
Yeah.
Okay. Another recommendation, Oksana, for you, the fourth bullet point can be merged with the following one, UMO. No, point, sorry, I'm in points 5 and 6 can be merged. Point 5 and 6 can be merged as complementary.
Well, may I, if I may? Well, actually, yeah, I also agree that it's a bit busy. And I think that vaccination exists PCV is not needed at all, because all the last, let's say 4 or 5 bullets actually state that you have in your country PCV vaccine, and even more, it describes how it is administered and what are the regulations. Yes, it's evident that PCV exists in your country. So I would, if I were you, I would have deleted the bullet 5 totally.
Okay, thank you.
Yes, if I may add a comment, and it is also related to the way, not to the content, but to the way the information is presented. No?
Mm-hmm.
Please bear in mind that maybe in the future you will be presenting in a conference with many other people in the session, and you will have a limited time for this, and you want to engage the audience, and that's why it's desirable to present in a more visual fashion the slide. No, so I mean, I'm not saying this is bad, but I will recommend a more visual aspect. So you want to impact the audience, you want to engage them, you want them to be attracted towards what you are going to present, and then they will provide very useful feedback. So that's why you want them to get engaging. No? For example, you could use at the bottom of this slide, you could use a bold font for this unexplored primary care doctors KIP towards power. So that's what you are aiming, no? What you're aiming to present. That you are highlighting a gap and you are presenting about that. No? So that's maybe an input. And also for the other participants, do not judge the slides only in terms of content, but also in the way they are prepared. Right? Thank you.
Thank you.
Great comments.
Can I ask you or suggest something on you, Oksana?
Please, Rehan.
I don't, it's, of course, it's nice, but why didn't you start, for example, with the definition of the disease? And clinical manifestations would be within the definition, of course, in not in details. And then you say the causative agent or caused by Streptococcus. For me, it would be, how to say it, more clear. And as Mariam said, yes, it's better that it is would be in 2 slides. One of them is general and the situation in the world, and the other one, the situation in Ukraine. Because as you know, for writing presentation, not more than 7 points the slides should have. But it's really nice information. Thank you so much.
Thank you.
Just another one question, Oksana. This sentence, Ukraine 222 PCV in vaccination calendar, is it already established as a goal of your government, or it is a recommendation still?
It is a goal. So we had a meeting with
You already decide that you are going to include PCV vaccine in immunization calendar?
It was decided by Ministry of Health of Ukraine based on consultation done with the National Group of Immunization, NITAC of Ukraine. So they recommended to Ministry of Health to consider this introduction of new vaccine into national calendar, and Ministry of Health decided to have this goal and to start with the introduction in 2022. Yes, this is a goal.
Okay. So you already decide, okay, it's going to be part, okay.
Yes, and actually, Milena, it was recommended by a national group of immunization experts to introduce this vaccine not only for children, but to elderly as well.
Yeah.
But, you know, we have limited resources, and Ministry of Health, after the numbers of consultation, decided to leave only children, but not elderly.
Not elderly. Okay, thank you.
Okay, so can we go to the next slide?
Okay.
So I'm gonna start this time. In my opinion, like for me, it's good because it tells me what are the objectives, and in order to why are those objectives set for anything. So for me, it's really nice slide. I don't have a comment here. Maybe my other colleagues have something.
I also think it's clear. So assess barriers doctors perceive towards PC implementation through the questionnaire. Recognize through the questionnaire barriers, yeah?
Yes. This question regarding barriers was included in a questionnaire, and we also asked our participants to evaluate these barriers, not just to select some barriers, because it was multiple choice type of question regarding barriers, but we also asked them to evaluate, is this barrier not a problem, or small, or medium, or big, just to know.
So you offered, okay.
If facilitators have nothing to add, maybe we can.
Sorry. I would read it in a different way. For me, the main objective is to address the gaps and misconceptions that will guide support the PCV implementation, right? And in order to address these gaps, you will do the KIP, the access barriers, etc. No? So I will put it the other way around.
Yes,
no? So your
around,
overall objective is understanding the gaps, and in order to understand the gaps, you will do the cap, pam. No? That's
yes,
maybe
absolutely.
the way I will read it.
Maybe that can be the goal, the main goal, and then those should stay as an objective again.
Yes, aim is one always. You aim to address gaps, and just to continue what Isra said, the misconceptions, etc. And then you can reach the aim by fulfilling the objectives, and your objectives are 3. And one thing for me, the slide starts with in March 2021, and I think this information is given before Yes, as I think in title you say that it's done in 2021, and in the background, I think that in March 2021 is a bit not quite needed here, because you know, it's already said this information. It's in the title. Am I right or not?
Yes, it can
Yeah.
start with just with assess. The objectives were to assess, and then in order to identify, like,
No, it can start with aim, because
Yeah.
aim is the most important thing, what you aim to do in your study, and then followed by objectives. And maybe year and month is not really here.
Thank you.
I think we can move to the next one.
Yes.
As I remember, Oksana, there is the second slide of the methods as well, yeah?
Yes. So I have 2 slides regarding methods, this one and the next continuation.
I think it's super clear, just the thing that, again, for me, there are too many sentences there, but it's really good structured and tells you everything. So there is inclusion and exclusion criteria as well, and then it goes to the second part of the method. So I think it's good. Just, I don't know how it can be made smaller due to the fact that you have already 2 slides, but the whole information is given. So for me, it's good.
If you want, for example, an advice when you want to remove a text from a slide, no? So, for example, what is already known or what you don't need to know, for example, no? Exclusion criteria. Do you really think it's important? I mean, for the slide and only having 10 minutes. So you just frame your target. It is internist, pediatrician, blah, 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 blah. That's it. That's my inclusion criteria. What is not there is the excluded, no? It's exclusion criteria. So you don't need to add that extra information. That's something that you can remove maybe. And for this slide, I will frame it like in 2 parts. One is the study design and the other data collection, no? And then think about, for example, how will I put this in a different way? Like instead of using sentences or like bullet points like this, I will put a table, for example, with a title for the study design, and then different lines for what I want to say about the study, and then another table for data collection and a few bullet points. That's only an suggestion, but yeah, I think it's important when to think about this when we prepare for a conference, no? How to make it more easy to read, easy to follow.
Thank you, Isra.
Yeah, just to continue this thing. Actually, the data, this is a method slide, right? And it says data collection, structured, self-administered online questionnaire. That's a method. That should be there, of course. And then you have these points, and they're not methods actually no longer. They actually, what about your collected information, right? With kind of parts of a questionnaire. Am I right, Oksana?
You are right.
Yes. So, and on the next method slide, which continues, you continue how you, can you show me the next method slide? Yeah. So now here you have kind of continuing the same thing, how you did it. Maybe in order to reduce this, the previous slide, not to be that busy, maybe you can delete this questionnaire part and just leave method as self-administered online questionnaire. And maybe you say just because you have to talk, you don't have to read the slides, of course. You can add talk, and then yeah, I mean, we just to delete this last 4.
Ekaterina, you advised me to delete this part. Oh, sorry.
Yeah, I mean, you know, everybody has their own ideas. We don't necessarily have to agree and do what we say, but not at all. Yes, but the idea what we all are saying is that to make our life easy, or somebody who's listening and watching to you, to make our eyes easy, we have the less we have to read is better for us. So we have this egoistic vision a little bit. So because you cannot delete sampling strategy, you cannot delete how you collected information, right? From us to tell. Some information is really imperative, which should be there in the slide, but some of them you can add in your speech. You don't have to read the slides. You have a slide which is helping you, and then you have your speech, which is corresponding to that particular slide. What I'm saying is, if you need to reduce this slide, if I were you, I'm not necessarily saying the universal truth, because people are doing things different ways. If I were you and I needed to reduce the information given on this slide, I would have get rid of the last 4 bullets. Yeah, I just left that data collection structure, the self-administered online questionnaire. Yes, and then when I talk, I will say that the collected information about social demographic knowledge, etc., etc. Yeah, that's to and then on the next slide you are talking how you kind of coded all this information and how you addressed it in data analysis. Yeah.
Well received. Thanks, Ekaterina.
Okay, you're most welcome.
Ekaterina, may I ask you? What do you think? What do you think? Can we put maybe a picture of or screenshot of the questionnaire if it's if it can fit on one page? So and just show. So these are questionnaire and explain to be as a picture.
Well, it depends how big is the questionnaire. Actually, so if it's too big and it's too small, then you're making my life even more miserable. You have to forcing me to read what is there, which I don't need. Maybe I'm happy with telling
I
me
always use a phone, you know.
Yes, self-administered online questionnaire. And I think when you just mention it, then on the next slide, you are nicely describing how you dealt with these points. I think that's enough, especially
it is.
Everybody is telling you to be fit in a specific time frame, 10 minutes or 15 minutes, whatever it is. So that's, and it's a matter of prioritization of the information you are giving to us, yes.
Okay, Oksana, Dragana is asking, was the questionnaire anonymous? So I remember, yes.
It was anonymous.
Yes. So we can move to the next one.
Meke-ին պրեզենտացիոնը ուզում եմ լսեմ, որ կոմենտ անեմ։
Արա կանջատի ցուկը։
Okay, we already discussed.
Yes, I think we can go to the results.
Yeah, we can go to the next.
Next one?
Yes.
Results, yes.
May I ask a question?
Yes,
Couple of questions for the previous one, the methods.
Yeah.
Yes, please.
So I am seeing the So I understand that you, Oksana, that you defined the questionnaire and divided the outcomes based on the scale, right?
Yes.
So you define five outcomes that were dichotomic.
You're right.
And then you perform a Poisson regression, right?
Yes.
How would it is done? Because the Poisson is especially with the ratios, but the rates and the numbers. So I don't understand. You use the ratio, or you calculate the prevalence and then carry out the analysis with the ratios.
I'm not sure I understand your question, Rodrigo, but I will try to answer. So, yes, we defined 5 outcomes. It were binary outcomes, okay? And we calculated prevalence ratios and 95 confidence intervals using Poisson regression, because Poisson regression model is appropriate model for cross-sectional studies. And ending IRR at the end of the model give us prevalence ratios. So
okay, but you may have used also the binomial regression as well.
Yes, but we discussed this issue with my scientific coordinator, and we decided that for my specific study, which is cross-sectional study, Poisson regression model is more appropriate. So we used this kind of regression model.
Okay, and my other question is regarding the scores. You from the questionnaire you create these scores of 4 different outcomes. It was based on a validated questionnaire, or you do it right from the scratch?
What do you mean validated questionnaire, Rodrigo?
Validation.
Because you can apply the same method to a questionnaire that is validated, or you can validate yourself your questionnaire. So I was curious to know about if you validate their questionnaire by I don't know, a factor analysis or another procedure, or you just use a questionnaire that was already validated.
Okay, so validation procedure was not done, and we created a scores for 5 outcomes from scratch. So, but for attitudes, specifically for attitudes and for practices, we used well-known method, Likert method of summated ratings. So, and for knowledge and PCV knowledge, PD knowledge, and overall knowledge, we just sum scores. And then we defined knowledge as low, moderate, and high.
Okay.
But
just,
it was not validated, Rodrigo.
Okay, that's more clear for me. So, well, a suggestion is that you can validate yourself with a pilot exercise with just 5 or 10 participants. You can validate it, well, using different criteria, statistical criteria, or with a group of experts. And then you can, well, write a paper also on the methods of validation, because I think this is very interesting, and maybe other people that can reproduce this study can use your validation method to their studies.
Thank
So
you, Rodrigo.
that's my comments. Thank
Great
you.
comments.
So can move to the next one, yes?
Can I ask one thing? So, as I understand, the sample size was 286. And out of the 286, 285 were female. Am I right?
Yes.
So only one man had in your study.
No. So all our questions in the questionnaire were not
Okay, I see.
mandatory.
243. Yeah, now I see. Sorry.
So we made as mandatory only 2 questions, but not as a questions, as mandatory questions, but we have a question regarding dosing of PCV, and we have a multiple choice grid for barriers. And these 2 were mandatory to complete each role. So for dosing for children, dosing for elderly, the same for barriers. To evaluate each barrier, participants select. So, but others questionnaires were not mandatory.
Okay.
So I don't understand now how many female and how many male doctors we have in the sample. 285 female doctors?
No, 243. 243. I read the table in the wrong way. 243, 85%. That's my understanding.
Oh,
243,
yeah.
and then it has 285, 42 male.
Only.
Only, yes.
Usually, actually in Ukraine, female doctors predominate, prevail among all doctors.
So, yeah, in all the world, yeah. But it is not balanced, this sample, and response rate. Please, I would like to ask our experts, because I'm not an expert. Is this low response rate, under 50%? Does this affect result? Does this produce bias or something like that?
Very good question, Milena.
I'm not clever. I just because this is really rare situation when someone puts response rate, and it is great. Maybe this is the second or third time that I see response rate people are putting that in our country. It is not so usual.
So my study population were primary healthcare doctors, and this is a very specific study population. And as for me, I am not sure, and if possible, facilitators, please correct me, but for me, 46%, it is a quite high response rate, taking into account that study population were doctors, and not currently, but usually doctors are very busy, and we invited them to participate in study, and also 2 reminders were done in order to achieve this response rate, and for me it's quite high.
What was your initial sample size? What you wanted to achieve? How many?
Say it again.
What was your initial sample size? When you calculated, when you developed your study design, and calculation of sample size, we all have to take into account the response rate.
So we invited to participate in a study 628 doctors.
Yeah, I know that you invited. You wanted 628 to reach that sample size. Because you usually, if you take into account the response rate, you should invite more to eventually to get the sample size you need.
Yeah, you are right. Yes, absolutely. But in order to know to see this number, I need to go to the study protocol. I am not remember by heart this number.
Okay.
I think, hello everybody, this is Zero. I think if I remember well, we accounted like a 50% non-response rate. So actually we invited double the people we needed in order to have enough power.
Mhm.
Yeah, fantastic. So you knew that, so you must be okay.
Yes.
Dragana is asking why is the age categorized as below and above 47 especially? Is this age important?
Sorry, maybe before moving to the next question, it's Adela speaking. So congratulations for the presentation and congratulations for the very much needed study. It's very interesting. So I just had a suggestion regarding the response rate. Maybe since you are using the list of doctors, if it is possible for you, if you have their age and the proportion that are female, what you could do is also test whether are differences with your sample. And if there are not, that's also an argument in favor of the validity and in favor of extrapolating your results to the entire population of primary health care doctors. Just a suggestion.
Adela, just to clarify, thank you very much for this suggestion. Just to clarify, so yes, I have a official list of doctors we used for sampling. So you advise me to state in this slide proportion of females in this list. Did I understand you correctly?
Yes, I was wondering, so here you are providing the age and the proportion of females in your sample. So, because we were discussing whether this response rate, whether is high enough for you to be able to extrapolate, so for you to consider that is representative of your entire study population. Maybe you can see whether, so the ones that have participated in the study have a similar age mean and median than the ones that have not, and the same for the proportion of females. So I was just advising, if you have the information for the entire list of doctors, you can just, for a number of chosen variables, just see whether there are differences in your sample from the entire study population. And if there are not, that's an argument in favor that the results could be extrapolated to the entire, so to say that there is no bias associated to with your sample selection. If in this case is available because you have the list of, the entire list of family doctors, if their age and sex is also available in that list.
That is interesting. Of course, in this list, because as I said, this list is officially available on web page. So everyone can find this list and see information regarding doctors. But age of doctor and sex of doctor, such information do not present in this list. But I can just see name of doctors and to know if this doctor man or woman. Okay, just based on name, but there is no separate information regarding sex, female, male, and there is no information regarding age of doctor because it's considered like personal data.
Yeah.
Okay. But what about the 628 you approached to? Maybe you know the 600 you approached to 628 doctors, right? So and you know something. Maybe you have more information about the 628 doctors those you approached than those are in the list. In Ukraine,
Yes,
I suppose that there are more doctors than 628, right?
yeah, for this 286, I have information regarding sex and age, of course.
Okay, so that would be nice as well to see, just to see that those did not respond, did not participate, whether there is a substantial difference between those participating in terms of characteristics. That would be also helpful to validate your data. And you also can see the in terms of area of work and type of facility to those did not participate, whether there is substantial differences in order to somehow.
Okay, thank you for your recommendations. So
And
Oksana,
just to ask, Oksana, did you receive some kind of feedback from people who denied, who refused to participate? Why
Yes.
they don't want to participate? Okay,
Yes.
so that is good. It is a complete new study.
Yeah, I received a lot of feedbacks from doctors. These feedbacks were positive. They called to me because my contact details were provided in all invitation letters, so they could contact me in case of any questions related to the study. And they contacted me, and their feedback was very positive because it's first time we conduct such a study in Ukraine, and they know regarding introduction of new vaccine into calendar, namely PCV. So, but sometimes I also received a negative feedback. So some doctors call to me and say that they do not want to participate because they are really busy with COVID vaccinations and they work in villages and they're very, very busy. And that's why they apologize, but they do not complete the questionnaire. So,
yeah, they cannot contribute. Yeah,
yes, because of business of doctors. Yeah, that was the main reason for denying.
Okay, Oksana, can we go to the next slide?
I will have one question if I may. Sorry,
have.
Oksana.
There is
Maybe I
also
missed
one
it.
from Anna. Sorry, one very interesting one. Annie, sorry.
Yes.
So I just had one question to Oksana. Maybe I missed it because I don't know why, unstable internet connection. So you sent this questionnaires by the mail, or maybe I missed that part. I'm just curious.
Yes, it was sent by the emails, but in a list of an official list with all primary healthcare doctors in Ukraine, we have only email of institution where doctors work, but we do not have personal emails of doctors. So we send these letters of invitation to institution email, but not to personally to doctors.
Okay, thank you.
Okay, next slide, please, Oksana.
Annie, can I ask something because I have raised my hand for quite some time?
Oh, sorry. Of course you can.
Please pay attention to the hands.
Sorry.
That's fine. Don't worry. Maybe this question has been answered, but I just would like to ask you, Oksana, first of all, congrats for the presentation. I just wanted to ask regarding the area of work and the type of facility. If you have an idea, I apologize if you have mentioned it, I might have missed it. If you have an idea of how the primary health doctors in general are distributed within these regions, like are the majority in the West, and I guess the majority of your facilities in Ukraine are state facilities. So I just wanted to ask this to see whether this kind of might be more close to be representative of your primary health doctors.
Thank you very much, Angeliki, for this question. Yes, if we look at area of work, so we can conclude that west-north part of Ukraine, so more doctors responded from the west-north part of Ukraine. And as I know that these parts of Ukraine are more populated, so especially west. So that's why there is more doctors work in these parts of Ukraine, because there are more healthcare facilities, because there is more population in west and north. So
So you mean, sorry to interrupt you, but so you mean, yes, there is a more population, so, but you don't have like a roster of the, let's say, of the primary health doctors that you do know that there are more doctors in this region. It's based on the population that you're
yeah.
Okay, that's fair. Yeah, okay. And about the facilities, most of them are state?
Yes, most of them are state, but we also invited a private practices doctors and private clinics doctors. But of course, probably 90% of healthcare facility in my country are state.
Are state, okay.
State, we also included municipal, because we have a state and municipal. But we consider that to say that this type of facility as state. And to private, we also included not only private practice, but also private clinics. But actually, in my country, private type of healthcare facility is rare comparing with state.
Okay. Thank you, Oksana.
Okay, thank you.
Sorry, just building on that is for my own awareness. Does the state buy the services of the private so that the vaccine will also be offered free of charge in the private or not in Ukraine?
So regarding a private and state type of healthcare facility, it doesn't matter if doctor work in state or work in private healthcare facility. If a doctor has a contract with National Health Service of Ukraine or to conduct preventive vaccination, so it will be free of charge for population, and it doesn't matter where doctor works, in state or in private. If doctor has a contract to conduct preventive vaccination, it could be done in state, in private healthcare facilities.
Nice, I understand. Thank you, Oksana.
Okay, thank you. Next slide, please, Oksana. We have only 20 minutes for 6 slides, so please be shortly and.
Just, I don't know, just like question. So in the knowledge, you have low and moderate combined together, and then you have moderate and high everywhere. So just due to the fact that I mean, I don't know how to formulate my question. So, okay, I'm just going to silence myself.
Mariam, your question related to definition of scores, why we define the PCV knowledge as low and why we define the overall knowledge as moderate, high, etc. So it explained in a methods part, and also I said this verbally, what approach we used for that. Because you are right, in a PCV, in PD knowledge, we have low, moderate, high, and in overall knowledge, we have low, moderate, high.
Okay, thanks. I missed it.
Facilitators, do you have something
Actually,
to add?
it's clear, really.
It's clear. Okay, then next one, please, Oksana.
For me, maybe somebody else wants to add something.
So we don't have time. Sorry.
Okay.
Oksana, is just a question also for my awareness. Are the like the against vaccination, these groups strong in Ukraine and also in general for other vaccines? Are your coverage rate among children high or so? That's also just for my awareness.
Yeah, thank you for this question. Unfortunately, if we are talking about vaccine preventable diseases, so the coverage is not sufficient in Ukraine among children. We have a huge problem with anti-vaccinators in communities, so we have a huge vaccine hesitancy in Ukraine.
Oh, I'm sorry to hear that. Okay, it was also to understand the answers in light of that. Okay, yeah.
Yeah, but in any case, I think that this slide is true, is informative, but what I will do going forward is to conduct the survey among parents, right? Because this is only the impression that the doctors have, so maybe it's not reflecting truly what's going on in the population. But of course, the information is good and points toward the need of further investigation, no? But among the population. So we'll conduct another survey, for example.
Yeah, thank you very much, Isra. You're absolutely right. And we, based on this funding, that parental related barriers were perceived by doctors. Based on these fundings, we would like to recommend Ministry of Health to conduct CAP study among parents to identify their caps and barriers, because as you very correctly said, that it is very a specific study population, doctors, and doctors perceived as barriers parental related, but not doctors, nurses related. And it should be confirmed, this funding.
Okay. Can we go move to the next one? I think yes.
We can start. So the slide looks great. Maybe only one decimal is needed, but it's more, I have a question. What does it mean, awareness of child-related ministerial order? No, I guess, or then, yeah, ministerial order. Can you explain that one?
Yes, sure. Ukrainian Ministerial Order, we called it UMO, Ukrainian Ministerial Order. This order has two parts, one related to children and another one related to adults. And this order is a specific ministerial order explaining vaccination procedure, vaccination recommendations in Ukraine. And this order included not only recommended vaccine, but also a mandatory vaccine. So, and explaining dosing, to whom, to which specific age group it should be administered, why, in which age, etc. This is a big order, and we found that those doctors who aware of the child-related part of this order were more knowledgeable regarding pneumococcal disease than those who did not aware about the child-related Ukrainian Ministerial Order.
Okay, yeah, I got it. It's clear now.
Okay, thank you. Maybe
Well,
we
actually,
can move.
one concern, we already said this one, but here about female sex versus male. I mean, the female group is really big in your study population. It's 85%, while the male group is really small. So that's, I don't know how that will be. It's not balanced, yeah. But in other way, the slide is really clear.
Okay, please, Oksana, next one.
What do you mean in limitations, Oksana, for social desirability bias?
So taking into account study population, primary healthcare doctors, and we thought that they could provide socially desirable responses. For example, do you think the PCV vaccine is effective? Do you think PCV vaccine is important, etc.? They could provide responses. Yes, it is very, very important. Yes, it is very, very extremely effective, etc. But their thoughts probably are different, but they just were afraid to express these
So
thoughts.
this is a type of information bias, kind of information bias, which comes from responder, so responder bias. Thank you.
Anyone else want to add something?
And the last one, response entry errors during questionnaire completion. What do you mean? Is errors, you mean the random errors when they wanted to say something and they said something? That's kind of described in the bias.
Here I meant, yeah, a response entry errors, I meant when doctor wants to select one specific option to answer, but for some reason the doctor selects other one because of.
Oh, is it electronically? They were doing it electronically.
Yes,
right.
they
Yes,
do.
so that's why. Okay, thank you.
So he can go to the next question, even though he did not answer the previous one.
Which one, Milo? Which one?
No, I just asked technical question. When you're answering the question in questionnaire, you can manage to put some limitation, not to go to the next question before you answered that one. So.
Yes, Milena, but you know that we decided to not have a mandatory questions. It was possible for participants to omit, to skip a question and go to the next one. Yeah.
Okay.
We should go to the next slide.
Yes, please, Oksana.
It would be really great if you can know the structure of the doctors in the population that is your sample. So how many female doctors you have and how many men. So to compare your sample and the conclusions, can it be generalized to all the population? I'm not sure that you have 85% of women, even though you have much more women than men. I think every country now has. But it would be really great to see correspondence between this your sample and the general sample of the doctors.
I will add a comment. For me, the slide is really informative. I think it explained what kind of questions I had there written here, so it's nice. Just again, my previous comment as well to maybe just make it again in two parts because it's too much to read. You know, when you were speaking, I was like, okay, I shouldn't miss anything. I should read it. I should read it. So it's too big the slide for me. So yeah, that's all. Otherwise, it's super.
Yeah. What I will continue with my comments from the beginning. No, try to put less information, and in fact, I would say that like half of the information here is already from results section. So it's not truly discussion. I would say like the second half is more related to what you expect for a discussion, and the first half is actually results. No, so maybe you don't need to repeat this, and just highlight these important points for discussions or the takeaway message you get from analyzing the results, which I think in my feeling is that is the second half of the slide.
Thank you, Idran.
I think we can move to the next slide. Yes.
Next slide, yes, please. So I agree with what Isra
Yes.
Mariam said. Well, just to continue this idea of putting less as possible, I would left here all these bold points you have, and the rest I would have
Yeah,
incorporated
true.
into my speech.
Could you please repeat because of it was really very loud?
Yes, I would say that just to I would leave here. I would have left actually all these bullet points. I mean, which you have in dark in bold, right? So develop proper planning, educational activities, content of educational program to include, conduct survey among parents to identify their gap and barriers as a slide to make it more concise and easy to read, and all you have under each bullet under this bold sentence, I would have included it into my speech.
Okay, thank you.
Yeah, we can go next.
Yes.
Say something, please, on that. This is Yorgos. I just wanted, to add one thing only. The first point about the recommendation to the Ministry of Health to develop proper planning, logistics, and supply. It's a recommendation, a suggestion. Probably it's also good, but is that really related with the study that you did? I mean, did you really assess the planning of the ministry or the specific campaign that is planning to do, but not yet, really implementing? Also the logistics, did you look at this and the supply system? Or it is, just referring to the perception of the people about how this will be working or how this might be the problem, to implementing this public health intervention. So I'm a bit concerned with the first one, being a little bit irrelevant in the sense of not coming really as in the logical sequence that goes from analyzing the data, the results, the conclusions, and then the recommendations. There's no, to me, kind of, sequence there and coherence, put it like this.
Oh, yeah.
So regarding Yes, thank you very much for this comment. Just to address that, yes, we did not access any planning, logistics, and supply. And this recommendation was given to the Ministry of Health because of we saw from the analysis, from the results, that doctors perceived vaccine unavailability and disruption in vaccine supply as the biggest barrier, and this barrier, I mean, unavailability of vaccine, disruptions with supply, was associated with PCV recommendation. So that's why we recommend to the Ministry of Health to consider developing proper planning prior to PCV implementation, and to include this proper planning issue into educational program, just to address these concerns of doctors. It is very important prior to the implementation of any vaccine to share the plan for supply, plan for the logistics with the doctors. So for them, in order for them to know how it will be planned. So that's why this recommendation, for my opinion, is very important. And that's why I have put it on a first place. So prior to the implementation of PCV, develop proper planning, logistic, and supply, because it was a concern of the doctors.
Was that concern measured?
Let me go back. Here, it was associated with positive practices, this concern. You can see the last bullet, that vaccine unavailability, it was associated with positive practices.
I'm a bit confused with that, Oksana, because it's vaccine unavailability in general, or it's specifically to pneumococcal vaccine. But then
it is,
we don't have the pneumococcal vaccine yet fully, let's say, supplied, right, in the system. I'm a bit confused, sorry.
So PCV vaccine is available in Ukrainian pharmacies. So because it is recommended for population, everyone can go to the pharmacy and buy the vaccine and go to the doctor and get vaccinated. So this barrier, vaccine unavailability, was specifically for PCV. It's not for general availability of vaccine, because the questionnaire was designed specifically for pneumococcal disease and PCV knowledge and barriers related to PCV implementation in the country.
Mm-hmm. All right. Thank you, Oksana. And if we go back to the recommendations, and I will not even talk more about, it's also the last recommendation, again, that is, to conduct a survey among parents to identify their CAP, knowledge added practice, and barriers. So now we are recommending to do another thing, target another group, to have some more information about their knowledge, attitude, and practice. But why specifically, you want to go that direction, and you don't maybe leave it a little bit, more less defined? Why? I would say, why not to do, for example, a combined study, qualitative and quantitative? Maybe, some focus groups, for example, might be, also giving very important information about, the attitude issues, and the practices issues as well. It seems to me, that if that is going to be, a strong recommendation to do, to target the parents, kind of, have the feeling that we just suggest something, but it could be also something else. Thank you.
Yes, thank you very much.
It's already 11:06. What we are going to do now?
I think have now to finish.
I'm sorry, I cannot hear.
We can't hear you.
question more?
Maybe it's better to write in chat because your voice is not clear. Or maybe again, it's my connection.
Any question? Any more question? No?
Oh, no
Then
question.
we have finished the presentation. Congrats to Oksana for the presentation. Thank you. Very interesting. And then we have made a break from 10 minutes. Okay, we come back in 10 minutes for the next presentation.